All right, here's a quick cardio blast for you. We're gonna warm up the core, jump up, do 2 rounds of intervals, and then end with a quick stretch. Start with that diaphragmatic breathing. Take your hands and I want you to just find those bottom 2 ribs. And I want you to just tap along those bottom 2 ribs. We're looking for that diaphragmatic breath. So you're gonna get into the back side of your body, the sides of the rib cage, the front. And as you do this, I want you to close your eyes. I want you to visualize the diaphragm contracting on that inhale, filling the sides of the ribs, extending the belly just slightly. And then as you exhale, you can start to think about your pelvic floor drawing up and in, or close front, middle, and back sphincters, and then gently lift up to the center of your body. Drop your hands down, drop your shoulders away from your ears. Take an inhale, fill ribs and belly. Exhale, think front, middle, and back. Close, lift. Feel that activation from hip bone to hip bone, the very deepest part of the core. Inhale, fill ribs and belly. Exhale, back to front, back, middle, front, activation of the pelvic floor, and then zip up the front of the body here. Take that 2 more times. Inhale, fill ribs and belly. I want you to go really deep with this core because we're trying to warm up the core so we can get up to those cardio intervals. Exhale, back to front. You can imagine a zipper. Starts at the tailbone, zips all the way up the front of the body. And release. And exhale, zip, wrap, and release. Bring yourself onto all 4s. If you're not comfortable on your wrists, bring yourself down to your forearms, and we're just gonna take shoulder blades together, shoulder blades apart, looking for that scap adduction. Adduction means to add or bring the 2 scapula or shoulder blades together. As you do this, make sure this isn't in your upper back and spine. This is low, right around the middle of the thoracic spine. Inhale, fill, slight separation. Exhale, drawing the bottom of the shoulder blades slightly together. Now as you do this, I want you to focus on that core breathing belly pump. Inhale, fill, ribs and belly, push the shoulder blades slightly away. Exhale, scapular adduction as you lift the pelvic floor and zip up the front of the body. Take that 1 more time. Inhale, fill, ribs and belly. Exhale, pelvic floor lifts, lower abdominals fire, shoulder blades draw slightly together. You have 3 choices here for this core warm-up. Level 1 is to take that core breathing belly pump at the top of your exhale where everything is in and nice and secure. You're just gonna lift a palm and put it down. You inhale, release, you exhale, go back into that belly pump, lift the other side. Inhale, release, exhale, lift a knee. So you're alternating between right palm, right knee, left knee. You're imagining that you have glasses of water down your spine. You only lift on that exhale when you've lifted your pelvic floor and you've wrapped those core muscles. If you feel secure here, you know that you're wrapping those core muscles, they're in, you're nice and stable. Level 2 is just to hold that position here and tap shoulder to shoulder. Inhale, fill. Again, the goal here is to not be shifting right and left. You've got to keep that core on nice and tight. Level 3 is to tuck those toes, lift those knees up. Find that scapular adduction and breathe. Keeping those core muscles in, never pushing down and away from your body. A little higher, a little deeper with the pelvic floor. 3, 2, and 1. Quick release in child's pose. You can walk those hands out. You can also stay up here at 45 degrees. Inhale, ribs and belly. Exhale, let go. Pop yourself up into down dog. We're gonna pedal and press to the feet here. Breathing, feeling that stretch in the hamstrings, backs of the legs. 4, 3, 2, and then walk your hands to your feet, feet to your hands. I want you to drive your weight down into the backs of your legs and your heels here. Bend your knees, drop your tailbone, roll up 1 vertebrae at a time. Feel that strength in your legs as you come up. Facing here. Roll the shoulders up and back and bring them forward. We're gonna head into 2 exercises for our first interval. The first one is a monster side step. So we're gonna find our hinge. 2 dabs of pain on those sits bones to the back wall. Test this position. I want you to make sure you don't feel this in your lower back. I want you to feel this in your glutes. Maybe you have to lift your toes, open up the chest and shoulders. This might be enough of your practice here to just stand here and take these little pulses. Especially if you have any pelvic pain or pelvic instability, I want you to stay right here, nice and even underneath you. If you feel good, you can start this first interval with those nice big side steps. You're just gonna practice your diaphragmatic breathing in this position. As you get tired, don't let your shoulders and chest round forward. Keep checking in to make sure you're feeling this in your glutes. I don't want this to be gripping in your quads or up the front of the legs. And the goal here is to get a little bit winded and start to burn those lower body muscles a little bit. 4 more, 4, 3, 2, 1. We're gonna take a modified burpee. Come to the top of your mat, arms overhead, this is breath in. Drive down in through your squat, nice deep squat to the ground, hands to the floor. You're gonna walk back to either all fours or a full plank. Your choice at the end of that to either add a push-up or not. That push-up should be felt in your pecs. So I want you to take those arms nice and wide. You can invert your fingertips wherever you feel those pec muscles fire. From there, you're gonna pop yourself back up, walk it up, drive down into your heels, find that low squat to stand. Arms go up and down. Either all fours or back to full plank with or without your push-up. Take it back up. You're gonna take these on your own timing. Take them as fast as you want, as slow as you need. The important thing is that you're feeling the right muscle groups. So it's not about speed, it's about the right activation. You can hold that plank, get yourself back up, find that deep squat to stand. You're gonna take 2 more of these. Inhale, walking yourself out with or without the push-up. Ooh. Pop it up, back up to standing. Last one, take it all the way down, either out to all fours, full plank, with or without that push-up. You've got this. Get yourself back up to standing, drive through those heels, find the posterior chain, your glutes, hamstrings, calves to stand. One hand on your heart, one hand on your belly, close your eyes, relax your pelvic floor. Take a nice deep diaphragmatic breath here. Feel that extra blood flow underneath that top hand, that's such a good feeling. Visualize as you breathe in, you're providing oxygen for all of those cells. Those cells are traveling to every part of your body. And when you get back into that diaphragmatic breathing, you're also turning on your parasympathetic nervous system, which is turning this breath into a recovery breath. One last inhale, exhale. Open those eyes, find that hinge position, nice and low, little side step, or pulses if you've got anything going on in the pelvis. You're finding your glutes here. I don't want this to be knee loading. This would be all the weight down the front of my knees. Get your hips behind you. Find that fire in those lower abdominals. Either pulse it out or take that nice side step. Just about 30 seconds here. You're 3/4 of the way done with these cardio intervals. And this whole workout is only about 10 minutes, so I want you to find that last little ounce of strength. Go a little deeper, push a little harder. Anytime your brain starts to push back a little bit, I want you to just focus on your breath. Positive energy, positive thoughts. 3, 2, and 1. Come up into those modified burpees, either back to all fours, with or without your push-up, or up in your full plank. Drive into that deep squat to stand. So I want you to find your breath here. These burpees are gonna look different on every single person because everybody's working on something different. Drive it. Looking for your glutes on the way up and the way back. Looking for your core in either that all four position or this plank. Looking for your glutes, lower body. Whew. We are almost there. Let's take one more. All the way up, all the way down. And get yourself back up to standing. Find those glutes on the way up. Good. Quick recovery. Hand on the heart, hand on the belly. Relax your pelvic floor. Air goes in. Every single cell in your body fills with oxygen and then takes that oxygen to every part of your body, from head to fingertips to toes. You can put a little bit of a sway in the hips here. If you need to hold on to something to balance, I want you to grab a chair, grab a wall. We're gonna take a standing quad stretch. You're just gonna bring your foot to your butt, drop that leg straight down underneath you. And if you have really tight quads and hip flexors, you can make this even deeper by tucking your tailbone under. Ooh, and you'll feel that all the way from the hip flexor down to the knee. Few deep breaths here. Again, hanging on to something if you need that extra balance, but you're gonna take that same leg, you're gonna cross your ankle over your knee, hips go back, chest comes forward. We're gonna take that standing figure 4. Countertop works here. And then we are gonna take this over to the other side, bringing your foot to your butt, dropping that knee straight down. If you wanna make this a little more intense or deep, tuck that tailbone under so you're scooping out the front of the body. Focusing on that deep breath. One more, inhale, exhale, and then again, continuing to hang on to something if you need it. Cross your ankle over your knee, flexion in that foot, hips go back, chest comes forward. You're gonna feel that stretch in the piriformis. Ooh, right here. Nice deep seat. Nice deep breath. And then take those arms out nice and wide. And then I want you to just give yourself a nice big hug here. Feel the stretch in the back of the shoulder blades. And then take it with the other arm on top. You're gonna take your chin to your chest, apply a little bit of downward pressure. Check in with that breath. Make sure that you haven't started holding that breath or that pelvic floor. You're still getting that flow deep into the belly. And then up and over to the other side. Awesome job today. Really quick workout just to get that blood flowing. Shake it out, and I'll see you soon.